Welcome to Lesson 2, the systematic approach to answering drug information questions and tertiary resources. The objectives of this lesson are to describe and demonstrate how to use the systematic approach to answer drug information questions, to demonstrate how to classify a drug information question and explain the importance of this step, to effectively develop and execute an organized search strategy, to effectively synthesize information gathered to answer a drug information question, and to write citations using the American Medical Association form. There are various methods that have been described listing the steps of the systematic approach to answering drug information questions. The one I give you here has three main categories and then some sub-steps. The main categories are: you receive a question, you search for the data, and you communicate the response. Within each of those, there are steps. When you receive a question, you collect caller information, you collect patient background information, and you determine the ultimate question and classify the question. When you search for the data, you develop a strategy and systematically search the literature. You also evaluate and synthesize the data you found. When you communicate your response, you need to formulate your response, evaluate your response, and provide a response and follow up with the caller. This slide spells out the steps that were shown graphically in the slide right before it. It is important to obtain basic information from the requester, whether the requester is a healthcare professional or consumer. This information will help you determine not only the requester's knowledge about the subject, but also the expected complexity or lack thereof of your response. For example, the same question asked by a consumer, nurse, or physician would most likely prompt a different response because of the requester's background medical knowledge. Deciding how you will answer the question, whether using lay language or technical language, will help you provide an adequate response to the requester. When you receive a drug information question, you will also need to determine when the answer is needed. In order to best contact the requester once you have the answer, you should always get the requester's name and contact information. Answers are generally provided verbally, in which case you will need a phone number or in writing through email. Here's an example. If a patient and a physician asked how the drug Letairis ambrisentan worked, you would provide a different answer for each. First of all, a physician would not ask how a drug works. A physician would ask you for the mechanism of action. You would not want to say to the patient, ambrisentan is a selective endothelin 1 type A receptor antagonist and a vasodilator. It is an orphan drug approved to treat patients with pulmonary arterial hypertension. Instead, you may say, ambrisentan is used to relax one of the vessels that provides oxygen to the lungs. You need to communicate the answer using familiar language for the requester. You also need to collect patient information. You need to collect identifying information such as the patient's name, ID, and location, demographic information such as age, weight, gender, race, but also medical history, diagnosis, comorbidities, allergies, medications, dosage, and pertinent lab values. Collecting appropriate background information is the most important step in the systematic approach. Without all the necessary information to adequately answer the question, you will find yourself calling back the requester to ask more questions. Moreover, the requester may ask you more questions when you call back. The most effective method for getting all the necessary background information is by conversing with the caller. You want to ask open-ended questions whenever possible, but direct questions are necessary to help you determine the true or ultimate question. This conversation will aid you in determining what question the requester truly wants answered. The type of background question asked depends on the type of question that you are given to answer. Some examples of questions include a question about an average drug reaction, availability, drug interactions, identification, IV compatibility, pharmacology, pregnancy, and unlabeled use. I will now walk you through several questions that you should consider depending on the type of question you are asked. Adverse drug reactions are different from adverse drug events. You may receive a call about an ADR when in fact the caller is describing an ADE, or medication error. All of these, ADRs, ADEs, and medication errors, fall under the umbrella of medication misadventures. It is your responsibility to report these events through the channels established at your work site. Several risk factors determine the likelihood of developing an ADR, and these include age, concurrent medications, duration of therapy, gender, comorbidities, narrow therapeutic index drugs, ethnicity, and genetics. The very young, that is neonates, lack fully developed organs for the drug metabolism, and the very old experience age-related changes in body weight, drug distribution, and metabolism. The more medications a patient is receiving, the more likely an ADR will occur. Likewise, the greater the degree of drug exposure, that is duration of therapy, the greater the likelihood an ADR will occur. Patients with more comorbidities are more likely to experience an ADR compared to healthy individuals. Narrow therapeutic index drugs such as digoxin have little room for tolerable drug concentrations. Ethnicity plays a role in pharmacogenetics, and the difference is seen in drug responses. When you receive a call about a potential ADR, you will need specific patient characteristics if a patient is involved. Questions you may want to consider, and a very important one, is the time and the duration of the adverse event. What is the suspected drug and dosage? What is the time relationship between starting and stopping the drug in the adverse event? What are the names, dosages, and routes of all drugs the patient is currently prescribed? What are the patient's specifics, age, sex, height, weight, etc.? Other questions to consider are, has the patient experienced this adverse event previously, or have they experienced this event with a similar drug? Was the suspected drug ever administered before? Why was it discontinued then? What were the events or findings that characterize this adverse drug reaction, the onset, duration, etc.? Has the intervention been initiated at this time? Is there a family history for an adverse drug event or adverse drug reaction or drug allergy? One of the best places to search for the incidence of an ADR is the package insert. The incidence is the percentage of patients who reported the ADR. Information in the PI is referenced in the drug compendiums under Adverse Drug Event or Contraindications Precautions section. Be sure to check the citation next to the ADR. It may very well be the PI. Keep in mind that the percentages listed by the ADR describing the incidence of the ADR are often from the MedWatch program, which is a voluntary reporting program. When using a drug compendium, you should search the section for adverse events. However, information could also be listed under contraindication and precautions. Keep in mind that adverse drug events reported post-marketing compared to adverse drug events reported in clinical trials vary with their incidence. In a clinical trial, we know the total number of persons that could have had that adverse event. However, in post-marketing data, we do not know the total number of persons that could have had that adverse event. So it's very important when mentioning the incidence of an ADR, you specify whether it's from a clinical trial or from post-marketing data. Here's an example. Does Cardura cause gynecomastia? A physician who works in the clinic calls you. I currently have a patient in my office and he complains of breast enlargement. Does Cardura cause gynecomastia? The patient takes over-the-counter cimetidine for heartburn and has noticed his breast a bit enlarged and was wondering about this. What should you tell the physician? There are several questions you need to ask before an answer is given. Other questions to ask include, why is the patient taking Cardura and what is the dosage? The patient is taking 2 milligrams once daily for hypertension and has been taking it for about 2 months. And then you need to also ask about cimetidine. The patient started cimetidine for heartburn about 6 weeks ago and has been taking 600 milligrams 3 times a day for 6 weeks now. You also need to know demographic information. The patient is 35 years old, otherwise healthy. He's 6 foot tall, 185 pounds, and his blood pressure is controlled. For answering this question appropriately, you do not need to know allergies. I know students love to ask healthcare professionals if the person is allergic to anything, and this is very important, but for some pointed questions, it's not as important. We already know that the physician is calling us about an adverse drug event. He is not calling to ask us about any allergies. So we can assume that the patient is not allergic to Cardura or cimetidine. One of the best places to look for this is in facts and comparisons under drug reports, and it's drug reports by adverse reaction. And you say drugs that may cause, and then you start typing in gynecomastia, and you see it pops up, so you select that hyperlink and you click Add. You will get a listing of all the drugs that may cause gynecomastia. So in other words, the system is looking for the word gynecomastia in the adverse drug event section of these drugs. And these are the monographs which have that adverse drug event. I'd like to note here that in these examples, I'm just choosing one database to use. All of the databases, Micromedics, Lexicomp, and Facts and Comparisons, they all have similar tools. I will need you to get in there and to use these databases to answer your drug information questions and to become familiar with the options in each of these drug databases. So you can see that cimetidine has been linked to gynecomastia. It is listed under the endocrine section in the adverse reactions portion. Gynecomastia has been reported in patients treated for 1 month or longer, in patients treated for pathological hypersecretory states. And you can read more about this adverse event. So in our example, the patient is not experiencing gynecomastia due to Cardura, but most likely due to cimetidine. So you also need to anticipate follow-up questions, and one of the follow-up questions the prescriber may have is, what is an appropriate drug to use for heartburn? So if you recommend that this patient stop cimetidine, you should also follow up with a recommendation to use instead of cimetidine. So in this case, the patient can use an H2 blocker or a PPI. Another type of question you may be asked is one about availability. And in such cases, you will need to ask some questions. What is the dosage form desired? What administration routes are feasible with this patient? What other special factors regarding drug administration should be considered, such as fluid restriction? So an example is, a nurse from the critical care floor calls. A patient who is currently receiving Sodalol oral tablets 100 milligrams twice daily is unable to swallow the tablets. What do you recommend? To find answers to availability questions, you can search the drug compendia. However, each drug database shows this information differently. Under Facts and Comparisons, you'll need to look at the product list, which is a tab located at the top of the monograph. You will find the schedule of the medication, the product name, the manufacturer, the generic name, the route, dosage form, strength, and market status. You can also check to see if the drug is gluten-free, alcohol-free, or dye-free. Under Lexicomp, it's within the monograph itself. It's under preparation section in the dosage form. In Micromedics, it's under the How Supplied section in the Quick Answers. And you can also use the Red Book, which is under the top toolbar in Micromedics under Other Tools. In the Red Book, you can find price changes, product names, active ingredients, manufacturer, distributor, generic name, Orange Book code, form, strength, route, package size, pricing. And in AHFS, you can look under preparations. Discontinued products are also listed in the drug databases. In Lexicomp and Facts and Comparisons, you'll see a product availability tab. In Micromedics, again, you should search Red Book, and it will tell you whether or not the product has been discontinued. So in this example for Sodalol, I typed in Sodalol in the search field in Facts and Comparisons, and it brings up the Sodalol monograph. However, if I want to know how Sodalol comes, whether or not it's a tablet, a capsule, a suspension, solution, I need to check the tab that states Product List, located up at the top below the drug name in the monograph. And you can see once I do that, I get a listing of all the Sodalols. I have the legend. This is a prescription drug to the far left. That's what the RX stands for. I have that it's Sodalol hydrochloride. I got the product name if it's a brand name product. I have the route, oral, intravenous. I have the dosage form, solution. So I do see that it's available as a solution in a 5 milligram per mil from Arbor Pharmaceuticals. I can click on the See More to find more information out about this specific dosage form. For disease information, I will look in Up-to-Date, Dynamed, and Clinical Key, which I reviewed with you during Lesson 1. For questions about dosing, you may want to consider what disease is being treated, what is the extent severity of the illness, what drugs is the patient receiving, does the patient have any renal, hepatic, or cardiac dysfunction? For drugs with renal elimination, what is the serum creatinine, BUN, and/or urine output? Is the patient receiving dialysis? For drugs with hepatic elimination, what are the liver function tests, bilirubin, and/or albumin? All of your drug compendium are a good source of information for dosing. You should start your search by looking in the dosing section of the drug monograph. Be sure to look in the appropriate subsection if the dose needs to be adjusted in renal or hepatic dysfunction. All the databases have the dosing section organized with normal adult dosing listed first. This is generally followed by pediatric dosing, then dosing in renal and hepatic dysfunction. I'd like to make a special note here to let you know that drugs are also adjusted based on body weight. Please pay attention whether or not the drug has to be adjusted according to body weight, and whether that's ideal body weight, adjusted body weight, or given as total body weight. Dosing, as you learn, can be specific to renal and hepatic dysfunction. To help you calculate creatinine clearance, the databases contain medical calculators. In Lexicomp, the calculators are right there below the renal and hepatic dosing. For questions about administration, you may want to consider asking what dosage form or preparation is being used, what is the dose ordered, what is the clinical status of the patient, could the patient tolerate a fluid push, is the patient fluid or sodium restricted, does the patient have congestive heart failure or edema, what possible delivery routes can the patient tolerate, what other drugs is the patient receiving currently, are any by the same route. You can search any of the drug compendium by checking the administration section of the monograph. If the information you need is not there, you may need to extrapolate information from the pharmacokinetic and/or drug properties section. For example, if you receive a question about crushing a tablet and the information is not present in the administration section, you may need to research the properties of the tablet that may prohibit it from being crushed. Usually, you would not want to crush an extended release or sustained release tablet because you may disrupt the delivery mode of the drug. When asked about opening a capsule and mixing the content in a soft food, you need to ensure the contents are stable in acidic and basic foods. Additionally, contents of some capsules are specially formulated beads that cannot be crushed. In such a case, the contents must be swallowed whole. Here is an example about an administration question. A nurse calls the pharmacy satellite and asks if Cadian capsules may be opened and given on a soft food. You ask and find out that the patient is having trouble swallowing. What response do you provide? For questions about administration, in this case, we can go to the Cadian monograph and we look under the administration section. And you will see that the first sentence there is, do not crush, chew, or dissolve extended release formulation, swallow whole. And then when you go down further, you can see that Cadian is listed. It says capsules may be opened and sprinkled on applesauce and eaten immediately without chewing. Do not crush, dissolve, or chew the beads because it can result in a rapid release of potentially fatal dose of morphine. Other questions to consider for dosing questions are, for drugs with serum level monitoring, what are the most recent levels for timing relative to the dose and the results? What is the patient's age, weight, and height? If a creatinine clearance or body surface area is needed. Are these lab values recent? Is the patient's condition stable? Does the patient have a known factor that could affect drug metabolism, such as acetylator status, or ethnicity, such as Oriental? A dosing question. A nurse practitioner calls your pharmacy and asks about the maximum daily dose for atomoxetine for ADHD in an adult who has liver dysfunction classified as Child-Pugh Class C. He is not receiving any other medications. What information do you provide? I just chose to search in Micromedics. I type in atomoxetine in the search field and it brings up the monograph. And this is one case in which, under quick answers, I can go to dose adjustments and I can see that it needs to be adjusted in hepatic impairment. Class C, Child-Pugh, is considered severe, and it states initial and target dose should be reduced to 25% of the normal dose. For questions in which it would benefit you to look up a drug class, there are several ways you can do this. You can search in AHFS Facts and Comparisons, Lexicomp, Dynamed, UpToDate, and Micromedics. Facts and Comparison and Lexicomps provide very useful charts that compare different drugs. All you need to do is type in the drug class name, and you will see it in the search bar. Micromedics provides a section in each specific in-depth monograph called Place in Therapy, which summarizes how that specific drug fits into the class. Micromedics also lists some class drug reviews, and on their home page at the bottom right, you will see where you can pull up some drug class reviews. Dynamed also lists drug class reviews. These reviews are quite useful because clinical practice guidelines and current review articles are cited. And UpToDate contains information also on drug class reviews. If you receive a call about a drug interaction, there are several questions you need to ask. If an interaction has occurred, what events suggest that the interaction have occurred? And you should ask the requester to describe this. Basically, you're asking them why they believe it's a drug-drug interaction. For drugs in question, what are the doses, volumes, concentrations, rates of administration, administration schedules, and length or duration of therapy? Has the patient received this combination or a similar combination in the past? And other than the drugs in question, what other medications is the patient currently receiving? And when were these started? Drug interactions are defined as the effect of one drug has on another to amplify or diminish its activities and clinical response. Two mechanisms exist by which drug interactions occur: pharmacokinetic and pharmacodynamic. Pharmacokinetic interactions are those in which one drug alters the absorption, distribution, metabolism, or excretion, the ADME, of another, thereby leading to a change in serum concentration. Pharmacodynamic interactions, on the other hand, are those in which one drug changes or adds to the intrinsic action or pharmacologic response of another. Drug-drug interactions are a major cause of morbidity and mortality and lead to an increased healthcare cost. Such interactions are responsible for nearly 3% of all hospital admissions and 4.8% of admissions in the elderly. And with the new drugs entering the market at a rapid pace, we've had 28 already approved this year in 2017. Identification of new clinically significant drug interactions is essential. Drug interactions are a common cause of medical errors, representing 3% to 5% of all inpatient medication errors. These numbers may underestimate the true public health burden of drug-drug interactions, as they only reflect well-established drug-drug interactions. It is impossible to memorize all drug interactions, for there are over 2,500 drug pairs, so you need to know where to look for this information. However, it is important to keep in mind that the most potential drug interactions never lead to an actual clinical effect. 35% to 60% of the elderly are exposed to a potential drug interaction, but only 5% to 15% have a clinically significant adverse reaction. It is therefore necessary to determine which drug interactions are clinically important or those most likely to cause harm. Here is an example of a drug interaction class review question. A physician wants to know why his patient's LDL decreased from 92 milligrams per deciliter to 17 milligrams per deciliter. The patient has been on Zocor for the past 2 years with LDL levels between 90 and 100 milligrams per deciliter. The only change to therapy was the addition of nifazodone a few weeks ago. To be safe, you decide to change the simvastatin to another agent. Which statins are the best choice? All of your drug databases have drug interaction tools. I chose Lexicomp. You simply type in the 2 names or more of the drugs you have to analyze. And here I typed in Zocor and nifazodone. And then once you get up an interaction, you will get a hyperlink. Make sure you click on that hyperlink and that will lead you to the monograph. You will see, if you click on this hyperlink, for nifazodone and Zocor, that nifazodone is a strong inhibitor of CYP3A4, thereby increasing the levels of simvastatin. So instead of simvastatin, which is also uses CYP3A4, you would want to change to a statin that does not. And one such example would be rosuvastatin. In such cases, I expect you to come up with an appropriate dose of the alternative statin. So you'd want to recommend rosuvastatin at a similar dose to decrease the LDLs at the same level as the patient was receiving with the simvastatin. For drug of choice questions, you need to ask certain questions. What do you want to treat? What medications, including doses, routes of administration, is the patient receiving? What are the patient's comorbidities? What are the patient's specifics, age, weight, height, gender, organ function, dysfunction? Has the patient received the drug previously? Was the response similar? Has the patient been compliant? What is the patient's name and location? Additional questions are, what alternative therapies has the patient received? Was therapy maximized for each of these before discontinuation? What other therapies are being considered? What monitoring parameters have been followed, such as serum concentrations, clinical status, other clinical lab results, objective measures, and subjective assessments? What is the patient's name and location? For questions about drug of choice, the best databases to use are UpToDate or Dynamed. For questions about herbal or complementary and alternative medicines, you can use Natural Medicine's Comprehension Database, Lexicomp, Facts and Comparisons, and Micromedics. You would ask the same background questions as you would, depending on what the question is about the herbal or complementary and alternative medicine, whether or not it's a dosing question, an adverse event question, or an efficacy question. You can find Natural Medicines on the library homepage under the Pharmacy Resources. You just type the herb or the alternative therapy you're looking for into the search field. In this example, I chose glucosamine. Now, when you get the listing of monographs and information, make sure you choose the professional monograph. One of the best sections in Natural Medicines is the effectiveness section. So this is the section where it's going to describe the efficacy of the product. So here for glucosamine hydrochloride, under effectiveness, you will see that there's insufficient reliable evidence to rate it for hyperlipidemia. For questions about identifications regarding specific markings, you would want to ask, are you looking at the tablet? If so, what is the dosage form, color, marking, size? Is everything visible? If you do not have the tablet in hand, what is your source of information? Was it reliable? What is the dosage form, colors, markings, size, etc.? Is anyone in the family or yourself taking any medications? If so, for what? Under what circumstances was this medication found? Who found the medication? An example of an identification question is, you are working in a hospital and a nurse calls the pharmacy saying that she will be coming down to the pharmacy for some tablets to be identified. They found the patient taking these pills by his bedside, and he was very defensive when approached to ask what the medications were. The blue tablet was round with the markings of Mylan A1 on one side, and the other was scored and blank. For drug identification via markings, I like Micromedics, the drug ID section. It's located on the top menu bar of Micromedics. Facts and Comparisons and Lexicomp also has a drug identification, but Micromedics and their drug identification has more products in it, so I automatically go to Micromedics first. All you do is type in what you believe is on side 1 and or side 2 of the medication and hit enter. You will retrieve a list of all possible products that have that imprint on them. Once you have that list, click on the hyperlink located below the drug name. As you can see in this example, alprazolam. If you click on the hyperlink below the drug name, you will get a window popping up that will provide you specifics of that drug. Here's what I mean by specifics of that drug. You get the drug name, the ingredients, and related products, but you also get the color, the shape, the imprint, the form, the NDC numbers, the excipients. So as you can see, this is very useful to determine the excipients if you have also a question about dyes in the product. But it also tells you the shape, and some of them have an image if you scroll down further on this window. When asked a question about a foreign drug identification, there are certain questions you should ask the requester. What is the generic or trade name of the product? Can you spell the name for me? If known, who is the manufacturer? How did you come by the medication? What country is it from? What is the suspected use of the medication? Are you or is the patient currently taking the medication? If so, for what? What is your source of information, and was it reliable? Here is an example of a foreign drug identification question. You are working at a local community pharmacy and a physician calls your office asking about a foreign medication, Lacomed. His patient was traveling to Spain and received this drug from a local physician for classic migraine prophylaxis. He was taking 2 milligrams every morning. The physician wants to know what the medication is and if there is an equivalent drug here. What do you tell him? The gold standard reference for identifying foreign drugs is Martindale's, located in Micromedics. This database provides information on drugs and related products used worldwide. It contains almost 200,000 preparations from over 40 countries organized into drug monographs. It is the gold standard for foreign drug identification. You should type the name of the foreign drug into the search field and then click on the link to Martindale's located to the right of the screen. Lexicomp also lists foreign drug products and is a good alternative to Martindale's. However, Lexicomp currently only has Canadian drug products. Martindale's should be your first choice for identification of foreign drug products. After you identify the foreign drug products, you will need to offer an alternative here in the United States if the drug is not available here in the United States. So in our example, I just typed in Lacomed in the search field and it brought me to this screen. Here I would recommend choosing the Martindale's link to Lacomed. Or you can also choose the hyperlink that's located in the middle of the page by the Lacomed Global entry. If you choose the hyperlink located in the middle of the page by the Lacomed Global entry, you will get a pop-up window offering for Martindale's, asking if you want to go to the cardiovascular drugs monograph or the lactidipine monograph. And in this example, I chose to click on the lactidipine monograph. I am now viewing the lactidipine monograph, and I can see that this is a calcium channel blocker. You can find more information by scrolling down on this monograph. It is a dihydropyridine, like calcium channel blocker, so it is not like verapamil or diltiazem. It is more like nifedipine. So the second part of this question was a U.S. equivalent. We don't use dihydropyridine type calcium channel blockers for classic migraine prophylaxis. We do, however, use verapamil for classic migraine prophylaxis. If you wanted other options for classic migraine prophylaxis, you would need to search in UpToDate and or Dynamed for the drug of choice for classic migraine prophylaxis. Be sure to offer an alternative to the requester if a foreign drug is not available here in the United States. For drugs regarding indication and therapeutic use, you can ask, what is the disease or condition you are treating? What medications, including doses and routes of administration, is the patient receiving? What are the patient's comorbidities? What are the patient's specifics, age, weight, height, gender, organ function, dysfunction? What patient parameters have been followed, such as serum concentrations, clinical status, lab results? And what is the patient's name and location? All drug compendium lists both FDA-approved and non-FDA-approved uses and the corresponding dosages. However, the format of this information differs. If you were to ask for all non-FDA-approved uses for a drug such as metformin, the best source to use is Micromedics because it generally contains the most expansive non-FDA list of indications. The quick answer summary organizes indication by whether it's FDA-approved, whereas the in-depth summary states this information under each specific indication listed in the therapeutic use section. Micromedics also rates the data supporting the indication according to available evidence. Lexicomp lists non-FDA approved uses and indications, and so does Facts and Comparisons. Facts and Comparisons also will link you to an off-label drug monograph, which is also very useful. In this monograph, you will have resources and references because the information written in this monograph is evidence-based. Both Micromedics and Facts and Comparisons are very good sources to find out more information on non-FDA approved uses, although all your drug databases will have this information. When asked a question about inert ingredients, I really do like you to go to the package insert first, especially when an allergy is involved. For the package inserts, I will be going over this in Lesson 4 when we talk about internet sources, but I'd like to find them on dailymed.gov. All your drug databases, however, will list inert ingredients. Facts and Comparisons, Lexicon, Micromedics will list all the inert ingredients. So inert ingredients include dyes, gluten, lactose, sugars, and alcohols. And in Micromedics, once you're there, we'll go and look under the toxin drug product lookup. If you remember with the foreign drug information, it's located to the right. It's a hyperlink, and there'll be a link there for toxin drug product lookup. You can also search under toxin drug product lookup by choosing it from the menu bar. So in our previous slide, I asked about Zoloft 25 milligrams and what inert ingredients are contained in it. So again, I go to the Tox and Drug Product Lookup, which is located under the other tools in the Micromedics top menu, and I can see number 2 there, Zoloft 25 milligram coated tablet, Bioring. I will have to click on the hyperlink link by the number 2 to find out more information. Once I click on this hyperlink, I get a new window that provides me product information. As you can see under the ingredients, the excipients do indeed include some dyes, DNC yellow number 10 and FDNC blue number 1 and red number 40. You can also see a list of all the other inert ingredients contained in Zoloft 20 milligram tablets. When asked questions about investigational or orphan drugs, you should ask the requester, why do you need this information? Is the patient in need of the drug or currently enrolled in a protocol? Why was the patient receiving the drug? What is the response when the patient was on the drug? What are the patient's pathological conditions? If a drug is desired, what approved or accepted therapies have been tried? Was therapy maximized before discontinuation? All of the drug databases list information on investigational and orphan drugs. Although this information may not be extensive, there is some information listed. Again, in Lesson 4, when we review internet sites, I will show you a government site that you can go to find out more information on orphan drugs and investigational drugs. When working in the hospital or in the home care situation, you often get questions about IV compatibility. And these questions involve quite a bit of background information. You need to know the intended administration route for the patient's medications. You need to know what kind of IV access the patient has, whether it's peripheral or central. And if the patient has a central line, does the patient have a single, double, or triple lumen? You need to know the doses, the concentrations, and volumes for all pertinent medications and solutions. You need to know the infusion times and rates expected or desired, and what is the base solution or diluent used, such as normal saline or D5 or D5NS or D5 quarter saline. Other questions to consider are, is the patient able to receive the medication through the IV route, IM route, or interosseously? Are the medications to be mixed in one syringe or given in the same line? If they're to be given in one line, what type of IV access does the patient have? Does the patient have a peripheral or central line? And does the patient have a Y site, a single, double, or triple lumen? A peripheral IV line consists of a shorter catheter inserted through the skin into the peripheral vein. Generally, IV drugs with a pH near that of the blood, which is 7.3 to 7.4, and an osmolarity similar to that of the blood, which is 285 to 310 milliosmoles per liter, are the best for IV administration, especially via the peripheral route. Peripheral IV drugs can be administered by direct IV push or IV bolus, usually over a few minutes, intermittent infusion over a short period of time, like 30 minutes to an hour, or by continuous infusion. If the peripheral IV line is not compatible with the IV bolus medication, 2 syringes with 3 mL of normal saline are prepared before giving the medication. The line is flushed before and after the IV medication administered through that line, and the IV line is flushed with normal saline. You may have heard of an IV piggyback. This type of IV admixture is aptly named because the medication is given on top of the main intravenous solution. This allows for the intermittent infusion of medications at specific times. The piggyback infusion usually is hung higher than the main IV solution and is connected to a port in the main tubing. Hanging the IV piggyback higher than the main solution causes it to infuse faster than the main solution. Central lines flow through a catheter with its tip within a large vein, usually the superior vena cava or the inferior vena cava, or within the right atrium of the heart. Lumens are multiple parallel compartments with a catheter. Catheters can be single, double, or triple lumen. Each lumen provides an independent access to the venous circulation so that incompatible drugs and fluids may be administered simultaneously. The picture illustrates a catheter with a double lumen, the one on the right. You can see that there are 2 ports in which IV medications can be given. There are several types of IV incompatibility associated with IV medications. These include visual, chemical, equivocal compatibility, and solution instability. Visual incompatibility is characterized by the presence of precipitation, visible particles seen floating in the solution, gas formation, solutions may appear carbonated, color change. Drug references will tell you the correct appearance of an admixed medication in a solution, or turbidity, where medications do not mix easily into a solution. A chemical type of incompatibility often involves the degradation of drugs to produce therapeutically inactive or even toxic solutions. Chemical incompatibilities may not be accompanied by any other visible clues. Equivocal compatibility is reported as an equivocal in situations in which signs of possible incompatibility are transient, such as turbidity that is resolved during a short period of time, uncertain or inconsistent. Solution instability is when a medication becomes out of solution or degrades due to the length of time it has been admixed or for some other factor such as temperature or light exposure. Other factors influencing solution stability are the dose and concentration of the drug, the number, type, and order of the additives given to the solution, and the type of volume of parenteral solution. For example, the electrolyte content of many parenteral nutrition solutions can alter stability of most IV medications. This is an example of complexation, where two or more compounds in a solution form a chemical complex that inactivates one or both. Here is an example of an IV compatibility question. You are working in the satellite clinic on the critical care floor, and a nurse calls asking if she can give midazolam IV push 2.5 milligrams per ml, total of 5 milligrams, with a heparin drip going at 160 units per ml at 2 mLs per minute in D5W. The patient has a double lumen central line. Facts and comparisons, Lexicomp, and Micromedics are all good sources to use. I want to show you Micromedics because there is a unique feature here in order for you to see the drug properties in the IV compatibility drugs. So here you choose IV compatibility from the top menu. You just type in the drug name in question and hit submit. So I typed in heparin and midazolam. I hit submit, and then I get an IV compatibility result. And here is midazolam. And if you notice at the top, I have certain tabs. I have solution, Y-side admixture, syringe, TPN, TNA. So I know that in my question, this was a question about a Y-side administration. So I want to make sure that the tab I choose to view is the Y-side tab. So after choosing the Y-side tab, I will tab down on this page until I come to heparin. And then I will read over to the right and see the rating. I do not want you just to know whether it's compatible or incompatible. I want you to click on the hyperlink. The drug names at the Y site are in blue. That means they're hyperlinked. So you would click on heparin and open the window to describe the interaction between midazolam and heparin. Once I click on that window, I will see a drug 1, drug 2, the status, the information, and test parameters. So here's where I will have the concentration of my drug 1 and 2. You can see the concentration of heparin. You can see the concentration of midazolam. You want to, as much as you can, match up the concentrations with what has been studied. You will see the information, which will provide you with a detailed analysis of what happens when those drugs are given together. Then you'll see the test parameters. Again, if you notice, the reference number is in blue. It's hyperlinked. So if I ask you for the first author of the study that assessed the compatibility between heparin and midazolam 5 milligrams per ml, you would click on that reference and another window would pop up providing you the author's name. So Micromedics has a unique feature where if I wanted to get drug properties of an IV product, and it's right here at the main IV compatibility results screen, and it's that little box with the arrow. If you see, that's also a light blue color, so that means a hyperlink. If I click on that box, I will get another window opening up that will provide me the properties of IV midazolam. So this is important because you may be asked the pH of an IV product, how much sodium is in an IV product, or another excipient. Some of our IV products have potassium, some have arginine. You may be asked for the osmolarity, and so you click on that little box with the arrow and another screen will open up. You can page down this screen and it will give you the IV drug property information. It's a little easier to access in Facts and Lexicomp, and I would like you to get used to using one of these databases for your IV compatibility questions. So just choose one and make sure you understand how to access the properties of an IV drug. For questions about OTC medications, you basically ask the same questions that you had before for therapy, for adverse event, for indication. And you can look in any of the drug databases, but I also want to point out that you have access to the Handbook of Non-Prescription Drugs. The Handbook of Non-Prescription Drugs is located on the library homepage under the Pharmacy Resources. It is in what's known as the Pharmacy Library. In the Pharmacy Library, you have access to various resources. If you click on the reference library, that's where you will see all the books that are contained within the pharmacy library. And one of those books is the Handbook of Non-Prescription Drugs. Under Resources, you will see a listing of books, and one of them is the Handbook of Non-Prescription Drugs, an Interactive Approach to Self-Care. You can click on this and you will have access to the entire Handbook of Non-Prescription Drugs. For questions about pharmaceutics such as storage and stability, you should ask, why are you asking? What is the medication in question? How is the medication stored and for how long? When will you need the medication if you are required to compound the medication? Was the product stored in the refrigerator at room temperature, and if so, for how long? Was the product exposed to sunlight? For how long? Was the product frozen? For how long? And when was the product compounded or prepared? All drug compendium have information about drug storage and stability. If you are unable to locate specific storage and stability information, you can call the manufacturer if needed. In AHFS, it is listed under Chemistry and Stability. In Facts and Comparisons, it's under Administration and Dosing. And the IV products are under Trissels 2 in the Drug Properties tab. Lexicomp is under Administration and Storage, and Micromedics is also under Storage and Stability in the Drug Dex or the in-depth section of the monograph. For questions about pregnancy and lactation, you should know what is the drug the patient received, the dose and duration, how old is the infant, and how long has the infant been breastfeeding? Is bottle feeding a possible alternative? What is the frequency and milk volume of the breastfeeds? How often does the baby feed? Does the mother have hepatic or renal insufficiency? What was the indication for the prescribing the drug? Was this the initial or alternative therapy? Has the mother breastfed previously while on the drug? For information about compatibility of drugs and breastfeeding, you can use several sources. Facts and Comparisons and Lexicon use Briggs, Drugs in Pregnancy and Lactation, the gold standard, and Micromedics uses LacMed, both of which contain extensive information. When researching specific pregnancy information in Facts and Lexicon, simply type the drug name into the search field and scroll to the bottom of the page. Once your search is returned, you will see Briggs, Drugs in Pregnancy and Lactation listed. There is also a database, which we will go over in Lesson 4 when I talk about internet sites that the National Library of Medicine runs that you can use to look up pregnancy and lactation data. For information about teratogenicity, you would want to know what is the drug the patient received, the dose and the duration, how old is the infant and how long has the infant been breastfeeding, is the bottle feeding possible alternative, what is the frequency and milk volume of the breastfeeds, how often does the baby feed, does the mother have hepatic or renal insufficiency, what is the indication for the drug, and has the mother breastfed previously while on the drug. Micromedics is a great source of information on teratogenicity. Micromedics contains reprotox and provides information on reproductive effects of not only drugs but also industrial chemicals commonly encountered in the workplace. It also covers physical agents including heat, noise, and radiation. Micromedics also contains Shepherd's Catalog of Teratogenic Agents, which has up-to-date information on teratogenic agents, including chemicals, food additives, household products, environmental pollutants, pharmaceuticals, and viruses. Micromedics also has TERA's Teratogen Information System, which provides information on teratogenic effects of drugs and environmental agents. When deciding if a medication is safe to take during pregnancy, you will often have to weigh the risk of the mother not taking the medication against the risk of the infants receiving the medication. Physicians may ask you for the data or the primary literature describing these risks. You should also be able to provide evidence-based information using the sources mentioned above. In addition, in Lesson 4, we'll go over a National Library of Medicine database, ToxNet, which provides very good information on medications and their potential for teratogenicity. So after you ask the appropriate background questions and get your responses, you need to then determine what is the ultimate question to be answered. You really want to ask the requester, why are they asking that question? The original question asked may or may not be the question that you truly need to answer. After you determine the ultimate question, you need to classify your question. Classifying the question allows you to choose an appropriate resource or database, and it provides you the section within the monograph to consult. Examples of types of questions include adverse drug reactions, availability, drug interactions, identification, IV compatibility, pharmacology, pregnancy, and off-label drug use. Once you classify your question, you want to develop a search strategy. The goal of answering a drug information question is to provide an accurate and complete answer while using your time wisely. To accomplish this, you will need to come up with a search strategy. Your search strategy begins with classifying the question. After you classify the question, you need to make sure that you understand all questions you need to answer in order to provide an accurate and complete answer to the requester. You always need to be prepared to answer any questions the requester has. Anticipating questions the requester may ask will help save time in the long run. As we had discussed before in the foreign drug identification, one of the most reasonable questions someone may ask you is, if not available in the U.S., what can they use in the U.S. that would be appropriate? And again, I don't like to see no's in your answers for your drug information questions. You need to find a suitable alternative. So for example, what's the dose of naproxen in a patient with creatinine clearance of 15 milliliters per mil? And you will learn that, or maybe you know, that NSAIDs really shouldn't be used in persons with severe renal dysfunction. So we want to know an alternative to this. So again, a good place to look would be to find out what they're treating and go to UpToDate or Dynamed under that disease state to find a suitable alternative. So one of our last steps is to synthesize and evaluate the data. During the evaluation of the literature, you need to objectively evaluate the information you found. Keep in mind who your caller is and exactly what the caller wants to know. It's a good idea to take notes on all the information you find. You need to answer any questions you come up with while researching the caller's true question. Evaluating and synthesizing the data is the most important step, along with collecting appropriate background information. When you evaluate and synthesize your data, your conclusions may impact patient care. Upon researching the answer, you may find that you forgot to ask an important piece of information. For example, if you forgot to ask the patient's renal function, and upon searching for the answer you found that the drug is cleared renally, you will need to call back the requester and ask for that patient's renal function. If you're unable to get a hold of the requester, I suggest providing the dosage for all types of dose adjustments if you forgot to ask about renal or hepatic function. So again, you would provide the requester the normal dose, the dose in renal dysfunction, the dose in hepatic dysfunction, the dose in obesity or ideal body weight, whatever the case may be. Also, during this step, when you're synthesizing and evaluating the data, you need to verify the appropriateness of your resources. For example, we don't want to use Google to answer questions if at all possible. And if you search the primary literature, you need to make sure you evaluate the actual study and not simply the abstract. Again, make sure that you use the resources available to you at the library for answering your drug information questions. Google is not appropriate, nor is Wikipedia appropriate. After you synthesize the data, you need to formulate a response. You need to consider the requester's background. Is this a patient? Is this a medical professional? Is this a physician, a nurse? You need to consider the means of communication, whether you are providing something in writing or verbally. And in writing, how are you going to write your response? Using the abstract style or inverted pyramid style? The abstract style is basically what most persons are used to, where you provide some background and then you provide the methods and the results and your conclusion. I, however, favor the inverted pyramid style, which I actually learned when I worked for Micromedics, which I'm going to go over in just a moment for you. In the inverted pyramid style, you start with your answer. So the first thing you want to put is information they must have for your communications to be successful. So in order for your drug information response to be successful, you want to give them the answer. So I really do appreciate it when students provide me the answer in the first couple of sentences. After you give the reader your answer, you're going to start providing additional information that's helpful but not crucial. And then lastly, you would provide information that would be nice if they would have it. So again, I do favor this inverted pyramid style. So you start with your conclusion at the beginning of the paragraph. This allows the reader to quickly identify the clinical content of the paragraph. Following the initial statement, provide the salient points of the study or the information you found that you consider to be relevant. You summarize the author's recommendations if you're looking at a primary literature article, and one sentence at the end of the paragraph. So again, you are providing the author, the requester, with your interpretation and synthesis of the data, not some other author's interpretation and synthesis of the data, but yours. So here's an example. We start with the conclusion. Weighing the evidence from the retrospective trials and the recommendations from the ACIP, the manufacturer's package insert, and the VA's advisory committee, live vaccines should not be administered to this patient. If vaccination is needed after the last dose of Stelara, wait until 5 half-lives and then administer the vaccine. Resume Stelara 4 weeks later. And if you pull up the notes page that I have also posted, you will see this drug information question that we were asked at my drug information service. So again, I really do like starting with the conclusion first so your reader can right off the bat, they know where you're going, they know what the evidence says, and then they can read further regarding the details and the why you are stating such. So the details added included recommendations from clinical practice guidelines and then also primary literature results. So remember that all your claims must be backed up with data and use objective data. What I mean by this is to use numbers when possible. We don't want to make any broad generalizations, and we want to support all claims that we make. And also double check and make sure that your conclusions match the data you presented. Remember, you need to reference or cite your information. You need to reference other people's ideas as a quotation, a paraphrase, and you need to summarize. You need to cite all facts, figures, and data. And when in doubt, cite. You need to cite throughout your document. And when you cite in text, which is what this is called, in-text citations, they need to be sequential from the beginning to the end of the document. You need to start with the number 1. So as you see my first sentence here, platelet antibodies against glycoprotein 9 may form after administration of H2 antagonists resulting in thrombocytopenia. Then I have a superscript number 1. That will lead me down to my references, and you can see my number 1 reference is this article entitled An Antibody from a Patient with Ranitidine-Induced Thrombocytopenia. The next sentence I write that I am going to reference, I will put a number 2 and list the reference as number 2 in my reference list. So again, your references are sequential, beginning with number 1 at the beginning of the document, working their way through the end of the document. So references use Arabic superscript numerals outside the periods and commas, but inside colons and semicolons. When two or more references are cited, you can use hyphens to join the first and last numbers of a closed series. And you can use commas without spaces to separate other parts of a multiple citation. So for example, as reported previously, the sun is yellow. And then I see my citation numbers, 1, 3 through 8, 19. So that means wherever this sentence appears in that article, references number 1 through 19 have already been cited. And you can see that 3 through 8, I can use a dash when I use references 3, 4, 5, 6, 7, and 8. The second example, patients tolerated the dose of 40 milligrams period, 3, 4. There is no space between the comma and the number 4. These guidelines are set forth by the American Medical Association, and we follow AMA guidelines. So with your references, you need to reference the sentence containing the information needing to be cited. Every citation has its own reference number. References should appear at the end of the paper in the order cited in the paper. Each source cited in the paper must appear in the reference list. Each entry in the reference list must be cited in the text. When you cite journal articles, you start with the authors, the article title, the journal name, the year, volume, and inclusive pages. You need to pay attention to the punctuation. When citing the author's names, you list the last name and then the first initial followed by the second initial if given. There is no punctuation. So for less than 3 authors, the example is written there below. You will notice that between the last name and the first initials, there is a space. There is no other punctuation. When there's more than 6 authors, you can list the first 3 and then you list ETAL, which is Latin and means and others or and colleagues. So notice that also it's an ET, lowercase, space, AL, lowercase, with a period. When writing the title of the article, which occurs after the authors, you write using sentence case. This means only the first letter of the title is capitalized. Do not capitalize every word in the title. You follow standard English grammar rules of capitalization, so proper names are capitalized. So which of these 2 citations is written correctly? I'm going to give you about 30 seconds to review these citations, and then I will let you know which one is written correctly. So, did you choose choice B? Choice B is correct because the title is written in sentence case. Only the first word is capitalized. Choice A is incorrect. The title has every word capitalized. This is not correct when using AMA style citations. So the next, after the title comes the journal's name. You need to abbreviate the name according to the National Library of Medicine's format. You can get this by this link here, and also by using the PubMed homepage. You'll see a link to journals referenced in the NCBI databases, and this has the correct abbreviation. You should italicize the journal name. And for online journals, you may cite as if they were hard copy unless they're only available online. When referencing drug databases, I want you to put the place where you are looking. The point of the reference is to give the reader a chance to look up the information for themselves. So if you're in the in-depth answers, you need to give me the name of the monograph and then in-depth answers, Micromedics Healthcare System. Same with the facts and comparisons and lexicons. Wherever you're looking is where I want to know. If you used a tool, I want to know you use that tool. So I would like you to cite it with IV compatibility, period, list the 2 drug names, period, and then wherever it was, micromedics or facts and comparisons. Please email me if you have any questions about referencing the drug databases.